In this morning's Health Watch, plastic surgery and senior citizens. Many people today in their 60s, 70s, and far beyond want to look as good as they feel. And that often means a nip here, a little tuck there. As CBS News correspondent Michelle Miller reports.
Oh, nice job.
Seniors today are living longer, playing harder, and feeling younger than previous generations. But as the sags, bags, and jiggly jowls creep in, an increasing number are turning to plastic surgery.
You don't have the Indian black, those slabs, right?
70-year-old Sandra Kaplan is part of that trend. A busy, energetic interior designer.
Easy, it's clean.
She became discouraged when friends repeatedly asked if she was tired. Sandra took a hard look at herself.
I kept looking at myself in the mirror and I was getting depressed. I was just sagging all over the place. It was horrible. My neck was a mess.
So Sandra had a facelift and her eyelids tightened, boosting her self-esteem and her business.
I was out with a client and we were going from like 10 o'clock in the morning till 7 at night. And she goes, "Aren't you tired?" I go, "I'm exhausted." She goes, "You don't look it."
People 70 years old are still working today. So the idea that the reasons for cosmetic procedures would be different for a 70-year-old than a 40-year-old, that's just not understanding what it means to be 70 now, is it?
According to the American Society of Plastic Surgeons, in 2010, more than 84,000 cosmetic procedures were performed on people over the age of 65. That's a 21% increase from the year before. Facelifts are the most requested surgery as seniors try to nip, tuck, and plump away the years. George Brandt is 70 years young. He owns and operates this Southern California bowling center along with his family. Brandt recalls the embarrassing moment that sent him running to a plastic surgeon.
One of my grandchildren was sitting in my lap one day and she was just playing with, I think they call them waddles. And I just thought, I don't really like this. This is really uncomfortable.
Dr. Jason Diamond says cosmetic surgery for seniors presents no special problems if they're in good health.
There really is no age limit to plastic surgery. The oldest patient that I've put to sleep for cosmetic surgery is 75. The oldest person that I've done under local anesthesia for cosmetic surgery is about 83. The key thing is to make sure a patient has a medical clearance and that they take care of themselves.
In fact, a recent study published in the Journal of Plastic Surgery found the risk of complications in people over 65 is no greater than in the younger population.
They might come back 3 or 4 times over the course of 10 years.
And as time marches on, both of his patients admit they'll probably be back for more.
I think that I'd like to do a chin implant.
I really don't want to look my age.
Michelle Miller, CBS News, New York.